Good afternoon. And today we have a pleasure of interviewing my patient, Mr. John Finnegan. Good afternoon, John.
Good afternoon, doctor.
And today we're going to talk about first-hand experience of different sleep apnea treatment. We're starting from a CPAP and oral appliances, Homeoblock, orthodontic treatment, and myofunctional therapy. So if you somebody who have a trouble sleeping or sleep next to the snoring partner, this interview is for you because it's real. We're going to dig into most intricate moments of our collaboration story, which lasts for 3 years. And we're going to talk about positive and negative sides of a treatment I offer to Mr. John. And if you're a medical professional and just like us, struggling to put all the puzzles of this difficult disease called sleep apnea together, this interview is for you. From mine and John's experience, I hope you're gonna learn, your own treatment strategy. And again, thank you very much to our audience. If you have any questions, please put them in the comments and we're gonna find the answers for you. If you want to share with your friends and family who struggling with sleep apnea, I really appreciate that. And please click the like and share button. So first, let me introduce my story with John because he's gonna have his part of the story. So John, he is a New Jersey resident. He is CPA and MBA, very educated gentleman who worked 25 years in pharmaceutical industry. And, all the areas of pharmaceutical industry, from accounting to finance to marketing and sale. And after that, he devoted his life to raising his beautiful family. And, he's doing volunteering job and he's a very intellectual man. So he is in charge of his health decision. 10 years ago, he was diagnosed with moderate sleep apnea. And I have a sleep study in front of me. He was stopping breathing 23 times an hour. And when he was on his back, it was 45 times an hour. So on the back, it was very severe. And he had experience with the CPAP machine, and he's going to share with us his experience with 5 different masks. And but because he's very intellectual and scientifically curious person, he tried to look for the root causes of a disease, and he came across of James Nestor book Breath, which not so visible because of my green screen, but we talk about that book on my channel quite a lot, and here it is. And he found my mentor, Dr. Belfer, and I had a lot of interviews about him. Unfortunately, he passed away last year, and then that's how we came together and start exploring different treatment. So now, John, I want to hear your story from you. I want you to share with our audience about your symptoms of sleep apnea and your experience with the therapy before we met.
Sure. Well, thank you, doctor, for the kind words. Well, my story initially started with my wife realizing that, experiencing me snoring and waking her up. So when that happens, I went to a doctor and got a sleep study done, and Dr. Sokolina gave you the results of that. So once you have that information as a patient, then the next question is, what are you going to do? Are you going to ignore it and have all the negative health consequences, or are you going to do something? I chose the second option, to do something. In addition to sleep apnea, I have, general anxiety. And as we'll discuss later, part of that is due to not breathing correctly. So everything's kind of tied in. So as Dr. Sokolina mentioned, I did try the CPAP machine. Many times the pulmonologist will send you to that machine first. I had, putting it mildly, not a good experience. I found the masks at night, which were on your face, would open up. There would be a space between the mask and your face. And then once that happens, the air pressure starts shooting out between your face and the mask, and that wakes you up. So we went through about 4 to 5 masks. None of them worked. I found cleaning the CPAP machine kind of annoying. It took time. And that's very important because if you don't clean it and you get bacteria buildup, that's getting pushed into your lungs. So you don't want that situation. So after the CPAP machine, my doctor had mentioned, I forget what the name of it is, but it's an implant.
Inspire. That time it was Inspire. Electrical stimulation for the tongue.
Yep. So they would put something in your chest, and when you're sleeping, if you started snoring, the microchip in your chest would recognize that and send a slight electrical impulse to the nerves in your tongue. So instead of your mouth relaxing and pulling back in your throat, your tongue in the back of your throat, it would stiffen your tongue and eliminate the snoring. Now, I had no interest in having an implant put in me for that. I wanted to get to the root cause of the problem, not treat the symptoms. Why? Why is this happening? And for me, as Dr. Sokolina showed you and I showed you, this book a friend of mine suggested, once again.
Yes, thank you, Mr. James Nestor.
Yeah, this was life-changing. This was a turning point for me. It was one of the best books I ever read. I think I almost highlighted every word in the book. It was that good. And one of the gentlemen he mentioned a lot was Dr. Belfour. He was in New York City. He's a world-renowned expert on these topics. And so I actually reached out to him, and he referred me to Dr. Sokolina. And that was a good thing for me. So the basic short summary of what happened, doctor came in. I went into Dr. Sokolina's office. They did a scan of my airways, and they saw clearly what I was experiencing, a narrow airway and throat muscles and a tongue that was not in great shape. You know, that's the best way I can put it. So we started out doing the myofascial exercises. And for anybody that doesn't know about them, there are different exercises you do with your tongue and your throat, you know, swallowing exercises. And
I would like to interrupt for a little
bit. Sure.
I would like to add part of the story, which very important to me, and I think important to my audience. Originally, when you came in with your diagnosis, my job is to control your apnea. That's why, yes, we discuss, you know, Dr. Belfour and Homeoblock, but I said to you, John, you stop breathing 23 times an hour. I cannot offer you the treatment without controlling that. I think it would be a great idea if I start with oral appliance. Right. And you said, you know, okay, we can go into myofunctional therapy. You know, I said to you, we can go to myofunctional therapy, but right. I want you to control the apnea at night because that's going to give you the energy. Now, I want you to share with our audience why this treatment, which I believe in, did not work.
Yeah, well, it was, to put it mildly, it's a large mouthpiece that you put in your mouth. And I think if I remember correctly, doctor, it shifts your lower jaw. Forward. So by doing so, it moves your tongue more to the front of your mouth. And that's it right there.
That was your appliance. Yeah. I mean, not this one, but so exactly the same.
By doing that, oh, shoot, my dog is barking. Oh, this is not good.
You want to take care of, no, yeah.
Because she's barking. These guys are trying to get in my backyard. Can I try to get her?
So we continue about after the short break to talk about, you know, oral appliance did not work so well for you because it's bulkiness and then moving the jaw forward. And we just continue with myofunctional therapy. But I think very important topic, what we kind of did not talk a lot about your sinus infection, what happened on a regular basis before we start treatment, and anxiety. A lot of times people with anxiety and sleep apnea, you know, that insomnia, anxiety, sleep apnea, get into that very dangerous bouquet, and a CPAP machine is difficult treatment choice for them. So I hope in our audience, there are some people who suffer from sinus infection, anxiety, and insomnia, and sleep apnea. So tell us a little bit about your sinus infection and, you know, myofunctional therapy and the Homeoblock.
Well, what's interesting is when your sinuses are more narrow and they're not getting the airflow, you're more prone to allergies and colds and sinus infections. So that was clearly happening with me due to my narrow airways and my tongue and my throat. So once you start doing these exercises, what I found is it strengthens your throat, it strengthens your tongue, and combined with the Homeoblock, which also opens up your mouth and your palate, all of these things take pressure off your sinuses and actually increase the volume of your sinuses. So what happens then, more air gets into my sinus, and that prevents bacteria buildup, which can lead to colds and sinus infection.
How often you used to have a sinus infection before we start treatment?
Probably a couple times a year. But even a sinus infection, sometimes a cold doesn't become a sinus infection, or allergies, which I had, don't become a sinus infection, but I'd have all three of those things throughout the year.
It's
And
multiple times. So tell us now how it is now.
well, for 3 years, I haven't had a cold. Now part of those 3 years we had COVID, so I wasn't out of the house a lot. So I thought maybe it was just COVID being home, but COVID's been over a couple of years. I'm out a lot. I have kids. I'm always around other people, other kids. I haven't had a cold now for 3 years. My allergies are still there a little bit. Like I might have to take Zyrtec for a week, but I used to have to take it for 3 or 4 months during the spring from like April to June when everything's starting to bloom. So now I basically have no allergies. I haven't had a cold. I hope I go the rest of my life without a cold.
I really hope so. So please share with us your experience. We're going to get to myofunctional therapy, of course, but when we decide not to use oral appliance, we decide to use orthodontic treatment to create more space for the tongue. But your myofunctional therapy, especially for the tongue, part what we devote to the tongue exercise, tongue would get more space. So share that experience with us, and how was orthodontic treatment? Was it difficult as an adult? Because you did have 2 rounds of orthodontic treatment before.
Yep. Well, it was really a threefold approach to provide me with these benefits. Number one, we started out with the Invisalign. My teeth needed a little bit of adjustment, and they were somewhat narrow. My palate was narrow, but so were the teeth. There wasn't much room. If I were to put a finger down in my lower jaw, I couldn't fit like a finger. It was that narrow. So the Invisalign helped open up my smile. So that was important. Step 2 was the oral appliance, the Homeoblock. And you can see here, it's a little retainer-like device.
Just put it like this way, yes, with the screw and a pad.
And then every 2 weeks, I would take this little tiny screw. It's like a paper clip. And there's a little hole that's hard to see under here where I would insert the screw and do one turn, a very tiny turn. And what that would do is widen the Homeoblock. I would put it in when I sleep, and it would put very slight pressure on my upper palate. Not much, but just enough over the period of how long, doctor? A year? How long was that?
It was around the year. And then we noticed, yes, your upper teeth, it was much more space, but the bottom teeth, even though we use clear aligners for 8 months, we did not get much of the space on the bottom teeth.
Correct.
And we both decide what we're going to use, some kind of an expansion for the bottom as well, to kind of follow up with the top. So for the audience who got lost, first it was oral appliance that didn't work. Then we start myofunctional therapy with Homeoblock after the first round of clear aligners to create more space. And to the upper Homeoblock, where the lower Homeoblock, for people who missed that part, John has first round of orthodontic treatment with 4 teeth removed. He was very narrow as a kid, and orthodontist aligned his teeth, making the space small. And just like he mentioned, he was not able to put the finger on the lower. And even though, according to the book, lower jaw does not get bigger with expansion appliances, tell us, John, did it get wider when you use lower appliance?
Oh, yes. Just like the upper part of my airway, the palate up in here, I have a smaller appliance. You can see this was for the upper, and then we made this one for the lower. It's the same approach. And in the past, like I said, I couldn't fit 2 fingers in my lower teeth. I couldn't even come close to doing it. And once we used the Homeoblock for the lower jaw, it was amazing. That was really amazing. So what happens is now it's wider. I can fit 2 fingers in. Not that that means anything, but it was my way of measuring how wide it got. Now, if you think about it, it makes sense because as your your jaw widens and your teeth widen, there's more room for your tongue.
And so, it doesn't fall into the airway.
Exactly. There's more room for the tongue. And when you're doing the exercises, the myofascial, that's the third component. It strengthens your tongue and your throat. So when you're sleeping, everything I just mentioned works in harmony. And that's the beautiful thing about it. So does that make sense, doctor? Did I explain that?
No, for me it makes sense because that's the treatment I highly recommend. Now, tell us about tape. In the beginning of the therapy, I ask you to use tape, which is a controversial issue for a lot of people. A lot of people scared of suffocation at night. Tell me your experience with the tape.
Well, in the book, James Nestor's book, he talks about that. In the beginning, they did a study where they closed their nose and breathed out of their mouth for a few weeks, and they had all kinds of sinus infections because there was no airflow. Then they did the opposite. They taped their mouth shut and they breathed through their nose, and it was unbelievable. Their colds disappeared, just like I explained. So I did try the tape that he mentioned in the book. It was like a medical grade tape, and I just taped
like this.
Here. Yes, exactly. That did not work for me because I'm allergic to adhesive. If anyone knows, when you put a Band-Aid on, you take it off, it's all red. So that got my lips red. And then I came across this company, Somnifix, which I use.
Yes, Somnifix, yes.
Okay, that's great. That tape doesn't irritate me. So before bed, what I'll usually do is take a little saline and just shoot some saline up my nose to make it moist.
Yes, that's very important. Yes. Or I don't remember, you also use like a washing the nose with a nail mat, or you just use
I use that rarely if I have a cold, but since I don't have colds, I don't use it. If I had a bad sinus infection, but I just get this from Costco. It's pretty inexpensive. A 3-pack is like $13, which is a good price.
Yes.
So I'll shoot some saline in each nostril, and then I'll use the mouth tape. And then once I'm asleep, there's really no issue about choking because the mouth tape has a really tiny hole in it. So if you do breathe and your nose gets congested, you'll have air coming through the mouth. And occasionally I've woken up and the tape has been off my mouth. So I think your body will automatically, it doesn't stick that strong that it's going to suffocate you. I've been using these a couple of years. So, I wouldn't worry about that. But with the myofascial exercises, keeping my tongue and airway strong, combined with the mouth tape, I mean, it's so, my life is so different, in terms of.
That's very nice to hear. Yeah. But tell me, during myofunctional therapy, we exercise your lips as well. You don't believe that your lips can stay closed even without tape?
I think they could. I think I do the tape as insurance, just like doctor said, when we're doing the throat exercises, you're also doing lip strengthening exercises. That's important. We exercise all of our muscles in our body. We walk and do things. Your throat and your tongue and your lips are all part of that. And I think
yes. Just like any type of fitness. That's beautiful. But now I want to bring back to an anxiety issue. Tell us a little bit about your anxiety and how that changed with the therapy what you're using right now.
Well, I think it twofold. Number one, we've talked several times about the airways opening up. That's important. Breathing through the nose, not the mouth. And that's important. But equally as important is having an awareness of how you're breathing, how your posture is, breathing through your nose, keeping your mouth shut and keeping the tongue on the roof of your mouth takes a little practice. That helps tremendously. Because if you slow down your breathing, as James Nestor suggests in his book, that automatically, for me, and I think for most people, will reduce anxiety just by breathing better.
This is such a beautiful words. And people, a lot of people who listen to us, they're very passionate about myofunctional therapy and about the fact that adult can change the lifestyle, that's the lifestyle. Breathing is a part of the lifestyle, and that's going to bring them so many benefits. And you're living representation of that fact. So to resume the whole interview for our audience, for somebody who tried CPAP with a 5 mask, try oral appliance, both of these treatment strategies were not successful, then got into clear aligners to widen space for the tongue, then Homeoblock, hopefully to move some bones, what sinus get more aeration, and you got rid of your allergy almost and sinus infection, and now you're on the last course of Invisalign to do the best teeth alignment. Can you tell us now what are you planning to do, because you cannot just stop?
Right.
And what else you doing with the bottle and all of that to maintain?
Well, like we said, it's exercising. You don't do exercising your body for 1 month and stop the rest of your life. You need to keep doing it. And the first thing I would say, it's not hard. It's just about making a little time each day and making it a habit. Once you make something a habit, you don't have to think about it. That's the point you want to get. And it doesn't take that long. So for me, there's a couple things I do to keep all of the benefits I described. Number one, I keep doing the exercises. Do I miss a day occasionally? Yes, that's normal. But I'll do them usually looking in the mirror in the bathroom. That's how you're supposed to do them. And it might take 5 to 10 or 15 minutes a night, depending on how many I choose to do. Now, you might think, oh, that's boring looking in the mirror doing that, but it's not. Everyone has a smartphone. I just put it on the counter, put on a baseball game, put on a podcast. The time goes very quickly. It's painless. It really is. The next thing I do is, I talked about this already, being mindful. And that's important, where your tongue is positioned in your mouth. Make sure your mouth nose breathing. Your mouth is closed when you're sitting at work. Your posture. We all sit at computers leaning forward with our necks, in an uncomfortable position. We get back pain. We get wrist pain. That's affecting your throat. So make sure, you sit up straight spine. That will help more than just your breathing. And then swallowing. Dr. Sokolina and her staff taught me how to swallow correctly. A lot of times we chew food in big mouthfuls and swallow quickly. She and her staff taught me through the Myofunctional how to make a small amount of food into a ball on your tongue, and then using the tip of your tongue. That's how your tongue works. That's how it's supposed to work. So all of those things really I continue doing. Like I said, sometimes I forget, it's not perfect, but most of the time I remember. And then the last thing that's been helpful, we all have water bottles. This is called Plenish. Okay. They sell it. It's a regular water bottle, but inside there's a straw with a metal. It's a steel straw. I'm dripping water all over the place. And at the top, you can see it has this device. It's just a rubber piece. So when you put that in your mouth to drink the water, your tongue has to press to the roof of your mouth. And what that does, it's kind of like a workout for your tongue without thinking about it. So I bring this everywhere when I can. And when you suck out of this straw, it's a good workout for your tongue. So that's in addition to the exercises that I'll do at night in the bathroom while I listen to music or whatever. So all these things become a habit. Then, like I said, it's not much time. It's easy. And then the health benefits, tremendous. I mean, you only get one shot with our bodies, right? There's no rewind. There's no, no one's laying on their deathbed saying, oh, geez, I wish I, didn't do all these good things for me. No one's wishing that. This is the chance we have to do it. You do it, get excited about it. Dr. Sokolina and her team are great. It's all good, but you have to do your research, and, there'll be some ups and downs, but that's expected for any health,
So first of all, I want to express, big thank you to Mariana, who spent a lot of time, explaining the swallowing and, really help you to get to the level where you are. But for people who still have doubts about myofunctional therapy, and I know there are a lot of colleagues of mine in the medical and dental community who don't believe in this model of treatment, tell us, from your hands, what happened when you had a repeated sleep study, not with saying you don't have sleep apnea just because your wife said you don't snore or your snore lab application doesn't show any sound. We actually repeat the sleep study, and your sleep apnea from 23 was reduced to 5 or exactly 6.2 in a different position. And what your sleep doctor mentioned when he saw the results, for you
Yeah,
not
no,
wearing appliance and
yeah,
getting that.
he was very impressed. He was very impressed because, like I said earlier, people use the CPAP machine, and that may be right for some people. That's okay, but that's just forcing air down your throat. It's solving the problem for some people, but it's not getting to the underlying cause, which we went through on this whole interview.
Yes.
So I think my doctor was impressed that we addressed the core root of the problem, the deep root, why this was happening, and just to see all of these many benefits in addition to reducing sleep apnea. I still have it a little, but it's virtually gone. It's amazing, all the benefits. And we're only touching on a few. I suggest people get that book because James Nestor talks about many other benefits besides just anxiety and sleep. It can affect blood pressure. There are so many things. I could spend a whole hour talking about this book. It's the best book. So, and I had the book, I had Dr. Sokolina, then a little bit of work on my part, and it's all worked out.
Thank you very much, John. We really appreciate your time and your being so passionate about the treatment. And I'm so glad what it helped you and appreciate you sharing it with us. Thank you.